What we're about to discuss is a powerful example of AI in action, one that's changing lives. We're joined by Colm McMahon with the University College Dublin, who together with Vertice have developed a patient-led companion app for people with asthma and COPD.
It's a fascinating use case because it takes something very human, how a patient feels, and makes it clinically useful in real time. Welcome to Oracle TV, Colm.
Thank you very much. It's great to be here today.
All right, before this work, patients had no way to easily share their experiences between appointments. Is that a fair way to characterize?
Yeah, I think that's accurate. When you're suffering with a chronic condition, it's with you for life, most likely. So you're going between appointments with your physician. You may be going to community centers for visits. And these are kind of single points of contact with your physician, which can be quite short. All healthcare systems are under a lot of pressure. The visits might be 5-10 minutes. So how do you tell the last few months of your experience with your chronic condition in such a short time? So yeah, it's quite difficult to capture the patient's voice in such a condensed sitting as a single appointment with a physician.
So I imagine for patients there's frustration, for their care teams there's inconsistency of information.
Yeah, when you're in an appointment with your physician, it's very short. You want to get it wrapped up. You want to get your key points across. Patients don't always remember their full experience of the last few months, so it can be sometimes not very productive. The physician is trying to get as much information in this session as possible to provide the best possible care, and they too are under pressure to capture that information as well. So this companion app can help them capture that in a more effective way and truly capture the patient voice.
So the companion app, it really does make a difference for the patients and the physicians or the clinicians.
Yes, yeah, most certainly, yeah. I think we're all used to using ChatGPT and other types of solutions currently on the market. People are now used to asking questions of these devices. With this companion app, it stays with the patient, and they can talk to the app about their experience if they've had an incident or a kind of a flare-up in their condition. What we've developed with Vertice also, it pulls open source data sets like pollen count, weather, etc., which can capture quantitative data as well as the qualitative information that the patient provides.
Wow. So, I mean, and you went from concept to pilot in record time.
Yeah.
Can you talk a little bit more about this?
Yeah, so we've been working with Vertice, an Oracle partner, for several years now. They were very excited about the launch of this. They came to us. We had a number of use cases that we had been working on. We have a very strong respiratory team in UCD Clinical Research Center, a very strong partnership with St. Vincent's Hospital Group, and we have two clinicians who are leaders in their field, Dr. Colm McCarthy and Dr. Alex Fraziosi. We approached them about potential use cases, and we brought the team together. Vertice looked after the technical aspects of it. That freed our clinicians to share their own thoughts and the nuances of the patient's experience and pathways with the technical team. It was an excellent partnership, and we managed to get a demonstrator up and running quite quickly, and now we're looking to see how we might scale it.
So I'm hearing lots of different data types in places where data exists, environmental and health data, as well as individual experience data. So lots of different data types. What were some of the advantages you had in using the Oracle AI data platform technology that you couldn't have done before?
Yeah, I think Oracle is very much about open frameworks. So we're in the process of trying to standardize a lot of our data sets using common data models. So that's one thing I think the AIDP allowed us to do. It was I think some of the new functionality around some of the AI tools allowed us to accelerate the development of that chatbot and the reporting functionality. But fundamentally, if you're using, and we use synthetic data in this particular pilot, but if and when we scale with this solution, we will need to have a very secure platform that can store this data, has full governance and oversight, and I think that's another key strength of what the AIDP will provide. Oracle are very well known for their security. I think that's a key differentiator for us.
Sure.
Well, this is obviously going to just be the start.
Yes.
So looking ahead, can you give us a glimpse?
Yeah, so I think the really exciting thing is about trying to capture that rich patient data, so converting it from the conversational data into structured data in a common data set. I think then we can look to capture that data amongst multiple patients and build a really unique data set that complements the clinical data, but it's patient data, it's patient-reported outcomes. I think we can look at other chronic disease examples, so COPD and respiratory in the first case, but there's many other conditions that we can look at. But we're excited about seeing how we might scale it. We're also looking at potential companion applications in clinical trials. So at the Clinical Research Centre, we do a lot of trials. And it can be difficult to capture the patient experience during those trials as well. So we have an abundance of potential additional use cases, but they all rely on the same architecture and the framework that we've developed with the IDP with Vertice.
Do you see a patient just on their own at home being able? There's some incident that happens, they record it. Yeah. So it's not just at the.
No, in our we're moving towards a more community-based care setting. So we have our hospitals moving towards more maybe acute care, the chronic disease, the chronic setting. Chronic disease will be managed in the community now more so than ever. So I think this is an excellent example of a solution that brings together the hospital setting, the community setting, but also in patients' real lives, how they can engage and share and capture their own experience in a way that empowers the patient to better manage their own condition, but also helps the clinicians to do the same, to provide better standard of care. It's all about a better standard of care for patients.
Well, that's great. AI for more proactive care for these conditions. Thank you.
All right.
All right, well with that, we appreciate you spending some time with us. And we are going to take a quick break and we will be back right after this.